I'm going to be very direct. If you're over 60 and you wake up tired, your morning erection has disappeared, and you feel like your body has failed you for no reason, what I'm about to tell you in the next 30 minutes is going to change your life. This is not an exaggeration. It's what I've been seeing in my practice for 25 years. And the solution lies in a mineral that you probably already have at home, but almost certainly you're either taking it the wrong way or taking the wrong type. Stick with me. I'm Dr. Cristina Navarro. I'm a urologist. For more than 25 years, I've worked exclusively with men over 50. Male wellness is my specialty, my passion, and my daily work. I tell you this because I want you to understand that what I'm about to share is not theory. It's what I see every week in consultations with real men who walk through that door, convinced that what's happening to them is simply old age. A few months ago, a 71-year-old retired engineer came to see me. He had always been active, disciplined, and organized throughout his life. He sat down in front of me and said something I'll never forget. Dr. Navarro, I wake up tired, I go to bed tired, and during the day, I'm not myself. This has been going on for years. His wife, sitting beside him, added quietly, "He doesn't feel like doing anything anymore." I examined him. Full blood work. And what I found was exactly what I see in 8 out of 10 men his age who come to my office: severe magnesium deficiency. Not testosterone, not iron, not vitamin D, magnesium. 3 weeks later, he sent me a text message. "Doctor, I woke up with an erection. I hadn't had one in 4 years." My wife couldn't believe it. I'm not telling you this to shock you. I'm telling you because I want you to understand that this isn't anecdotal, it's systematic. And most doctors don't see it because no one taught us to look for it. Let's get to the heart of it. I need you to understand what happens in your body every night because once you do, magnesium will make perfect sense. While you sleep, or rather, while you should be sleeping deeply, your body does 3 essential things it can't do during the day. 1, it produces testosterone. The peak production of testosterone in men occurs between 3 and 7 in the morning. Not when you work out, not when you eat well, at night while you sleep. 2, it repairs muscle. The micro tears from the day are rebuilt during deep sleep. If you don't reach that deep sleep phase, you don't recover. 3, it cleans the brain. The glymphatic system, the brain's cleaning system, only works during deep sleep. It removes toxins, consolidates memory, and regulates mood. Now tell me, how many nights have you truly been sleeping? I mean really sleeping deeply without getting up, without tossing and turning, without waking up feeling unrested. That's what my patients' bodies tell me before they even speak, that for years they haven't been repairing themselves at night. And why does this happen? Because the autonomic nervous system, the one that decides whether your body goes into repair mode or alert mode, needs magnesium to function properly. Without enough magnesium, the nervous system stays in tension all night long. Your body never relaxes, never enters deep sleep, doesn't produce testosterone correctly, doesn't repair muscle, and doesn't clean the brain. Think of it this way. Magnesium is the conductor of the orchestra for everything that happens while you sleep. Without it, each musician plays on their own, and the result is noise, not music. Here's the part that surprises my patients the most, and honestly, the one that frustrates me the most. After age 60, the male body literally becomes a magnesium wasting machine. Even if you eat well, even if you follow a healthy diet with spinach, legumes, and nuts, you're still deficient. Why? I'll give you 3 concrete reasons. First reason, the soil isn't what it used to be. The foods we eat today contain 50 to 80% less magnesium than the same foods did 50 years ago. Agricultural industrialization and the massive use of fertilizers have depleted magnesium from the soil. Those organic spinach leaves you buy so carefully have only a fraction of the magnesium that the spinach your father ate had. This isn't just me saying it, it's backed by FAO studies and multiple international agricultural reviews. Second reason, your gut absorbs less. With age, gastric acid production decreases significantly. That acid is essential for extracting minerals from food and transporting them into the bloodstream. By age 65, you can absorb up to 30% less magnesium from what you eat. You eat more than you need, but absorb less than you require. Third reason, and this is the one that concerns me most clinically, medications are silently stealing your magnesium. Antihypertensives, especially diuretics, eliminate magnesium through urine. Statins that so many people take for cholesterol interfere with magnesium metabolism. Proton pump inhibitors, those antacids that people take like candy, drastically reduce magnesium absorption in the intestine. If you're taking 2 or 3 of these medications at once, which is very common after 60, your magnesium deficiency can be severe even if you eat perfectly. And the problem is that in standard blood tests, serum magnesium almost never shows changes because the body maintains blood levels by robbing magnesium from bones and tissues. So your doctor looks at the lab results and tells you you're fine, while you're in deep cellular deficiency. This is what isn't being said, and it's what I've been telling patients for 25 years. Now I'm going to describe something. I want you to tell me how many of these symptoms you recognize, and I want you to be honest with yourself. First, you get up to urinate 2, 3, or 4 times a night. And it's not because your bladder is full, it's simply an urgency, a restlessness that pulls you out of bed. Many of my patients tell me, "Doctor, I thought it was my prostate." Sometimes it is, but in most cases, the first thing that happens is hyperactivity of the nervous system due to magnesium deficiency. The detrusor muscle of the bladder, like all muscles in the body, needs magnesium to relax. Without it, it contracts involuntarily. Second, nocturnal leg cramps. You fall asleep and suddenly you're grabbing your calf in pain or the arch of your foot with the muscle in spasm. That's the signature of magnesium deficiency. There's no more direct pathophysiological explanation. Calcium contracts muscle, magnesium relaxes it. Without magnesium, calcium has no counterbalance and the muscle fires off. Third, superficial sleep. You're in bed for 8 hours and wake up as if you hadn't rested. You don't reach deep sleep because the autonomic nervous system, without magnesium, never drops out of alert mode. It's like trying to sleep with the engine running. Fourth, and I know this is the hardest to say out loud, the morning erection has disappeared, or it's weak or irregular. Listen to me carefully. Morning wood isn't just about desire, it's a physiological indicator of vascular and neurological health. Blood vessels need magnesium to dilate properly. Nitric oxide, the messenger that dilates the blood vessels in the penis, depends directly on magnesium availability. If magnesium isn't there, the erection doesn't come or comes weakly. This is not normal aging. This is a correctable symptom. Fifth, unexplained irritability and brain fog. You're in a bad mood for no reason. You snap at small things. Your partner notices, you notice, and on top of that, you forget things. You walk into a room and can't remember why. You search for words that used to come easily. Magnesium is the most important mineral for neurotransmitter function. GABA, serotonin, dopamine all depend on it. Without magnesium, the brain is literally inflamed and overexcited. If you have 3 or more of these symptoms, you have a magnesium deficiency. I'm not saying it's the only cause of everything. I'm saying it's a direct causal factor that can be corrected. Okay, now that you know you need magnesium, I'm going to explain why most men who try taking it notice nothing. And it's because they make a basic mistake. They buy the wrong type. There are more than a dozen forms of magnesium on the market, and most are useless or nearly useless for what you need. I'll save you the trial and error. Magnesium oxide is the cheapest and most sold. It's what you'll find at the neighborhood pharmacy if you just ask for magnesium. Your body absorbs approximately 4% of what you take. The other 96% goes straight to your intestines and gives you diarrhea. It's basically a laxative mislabeled. Discard it. Magnesium citrate is better than oxide, but it's still very stimulating for the intestines. If you have a sensitive colon, you'll spend the night in the bathroom. Not what we're looking for. What works? Two forms. The first is magnesium glycinate. It's the form bound to the amino acid glycine. It has excellent absorption, doesn't irritate the intestines, and glycine itself has calming properties on the nervous system. This is the form I recommend for sleep, for cramps, and for nocturnal muscle relaxation. The ideal dose for a man over 60 is between 200 and 400 milligrams taken 30 to 60 minutes before bed. Not earlier, not with breakfast, at night. The second form is magnesium threonate. This is the form that studies have shown efficiently crosses the blood-brain barrier. It's the brain magnesium. If your main problem is racing thoughts before sleep, nighttime anxiety, or daytime brain fog, this is your form. The usual dose is 1 to 2 grams of the total salt, which provides approximately 140 mg of elemental magnesium. My practical recommendation to start: glycinate. In just 1 week, you'll notice the difference in sleep and cramps in the first few days. Once you've been on it for a week, you can add threonate if you feel the mental and cognitive aspect is still an issue. And one more thing. If the label only says magnesium 500 mg without specifying the form, return it. That's not information, it's opacity. Demand to know what form you're buying. I'm going to describe what you can expect when you do it right. And I want you to be clear about this because many men give up too soon expecting dramatic results the next day. The first night, you may not notice a dramatic change, but something subtle happens. It becomes easier to fall asleep. Those tosses and turns in bed decrease. Some men tell me they have very vivid dreams the first night. That's the sign that your brain is entering the REM phase like it hasn't in years. The second and third nights, this is where it starts to become evident. Men write to me, "Doctor, I only got up once this night instead of 3. I woke up and my back didn't hurt." Accumulated muscle tension begins to release. Cramps disappear or decrease significantly from the 4th to the 7th day. Here, 2 things happen that are emotionally significant for many men. First, morning erections return. They may not be perfect yet, but they're there. And for a man who's gone years without them, that's an important moment. Second, the 3 p.m. energy crash disappears. Energy remains more stable throughout the day. In the second week, the changes consolidate. Sleep is deep and continuous. Erections are firmer. Mood stabilizes. Mental clarity returns. And the person closest to you, your partner, notices before anyone. From the 3rd week onward, this becomes your new normal. Your body has replenished its magnesium reserves. But careful, this is important. You can't stop. Magnesium deficiency reproduces itself because the causes that create it are still there. The poor soil, the gut that absorbs less, the medications you take. Magnesium is not a one-time cure. It's daily maintenance, like brushing your teeth. Once you've been taking magnesium for 2 or 3 weeks and you tolerate it well, there's a combination I've seen work consistently in my patients. It's called ZMA, zinc, magnesium, and vitamin B6. Zinc is to the male hormonal system what magnesium is to the nervous system. After 60, zinc deficiency is almost universal. Zinc is a cofactor in testosterone synthesis. It's essential for spermatogenesis, even if that's no longer the goal, and for immune function. And zinc deficiency worsens magnesium deficiency because they compete for the same metabolic pathways. Vitamin B6 acts as the facilitator. It improves absorption and utilization of both zinc and magnesium. Without it, part of what you take is lost. The dose of the combination, 30 milligrams of zinc, between 400 and 450 milligrams of magnesium as glycinate, and 10 milligrams of vitamin B6. All taken on an empty stomach 30 or 40 minutes before bed. 2 warnings. First, don't take it with calcium or dairy. Calcium and magnesium compete for the same intestinal transporters. They block each other. If you take a calcium supplement, separate it by at least 2 hours. Second, don't take it with alcohol. Alcohol not only competes with absorption, but also increases urinary excretion of magnesium. A glass of wine at 10 p.m. and your magnesium supplement loses much of its effect. Let's get concrete. No beating around the bush. This is exactly what you do this week. Buy magnesium glycinate, not oxide, not citrate. Glycinate. Starting dose 200 milligrams. Take it 40 minutes before bed. With water, no dairy, and no alcohol that night. Just that. Next week, if you tolerate it well and don't have loose stools, increase to 400 milligrams. That's the maintenance goal. If after 2 weeks your main problem is still racing mind or daytime brain fog, add magnesium threonate 1 gram per day, also at night. If after a month you want to enhance the hormonal effect, add zinc and B6 to complete the ZMA. Put it next to your toothbrush, not in the medicine cabinet, not in a drawer, right next to your toothbrush. So it's automatic and you don't have to remember it. And I ask one thing of you, give it 21 days before judging the results. Magnesium is not a fast-acting drug, it's a progressive recharge. Give yourself that time and then decide. Look, I've been working with men for 25 years, and what hurts me the most is not the illness. It's seeing a man give up on his vitality. Convinced there's no solution, accepting fatigue, lack of desire, and broken sleep as if that's simply what comes with his age. It isn't. One mineral, the right dose, the right type, at the right time. Sometimes the difference between how you are and how you could be is that simple. If this video has helped you in any way, share it with someone who needs it. Subscribe if you want us to keep having these conversations, and write in the comments your age and which of these symptoms you recognize. I'm interested in knowing. I'm Dr. Cristina Navarro. See you in the next one.